threats in South Asia. We would like to begin with recitation from the Holy Quran.
بسم الله الرحمن الرحيم قل أعوذ برب الناس ملك الناس إله الناس من شر الوسواس الخناس الذي يوسوس في صدور الناس من الجنة والناس.
Our first session for today is on contemporary non-traditional challenges confronting the region. Our session chair is going to be Dr. Salma Malik, who is an assistant professor at the Department of Defense and Strategic Studies, Quaid-e-Azam University, Islamabad. The topics that we will be covering in this session include dilemma of rapid population growth, tackling the scourge of poverty, dealing with the necessities of education and health, and overcoming energy shortages. I hand the floor over to Dr. Salma Malik to take the session forward.
Thank you very much, Zanera. I'm truly honored and extremely grateful to the Institute of Regional Studies, to Ambassador Nadeem Riaz for this honor, and grateful to the entire audience who are here and slowly trickling in, given that it's the morning rush hour traffic, plus the fact that several people are juggling their official routines to join this session with us today. When we look at security, as has been discussed in the first 2-3 sessions that we had since yesterday, security is no longer a construct which is to be seen in the traditional realm. We have several challenges that affect not only the traditional security, but it also affects the overall general well-being of the state as well as the society. And these things fall in the ambit of non-traditional security. And however exclusively we may try to maintain a lens that the traditional and the non-traditional are two separate entities and should be treated as such, academically, yes, absolutely. But when we look at them in a larger context, security can only be realized and can only be fulfilled if we have a holistic lens towards it. Few of the aspects of security may not look linked with the traditional issues, but without economics, without education, from the immediate to medium to long-term range or to long-term situation, security affects each other. And no country can be self-sufficient if they do not have the adequate means and tools to progress, which of course includes education, it includes food, it includes health, good health. It also includes, definitely it includes as part of the top agenda, economics. We have with us today several very eminent speakers. We have Dr. Shamail Dawood Arai, who would be looking at education and health. We have with us Engineer Ehsan Javed, who would be looking at the very, very pertinent energy shortage issue. And we have just been joined by Dr. Sabina Durrani, who is going to be sprung a surprise that the sooner she sits down, she's going to start speaking, who is joining us to look at a very, very critical issue, but please don't harass her. She has nothing to do with it, population growth. And I hope she has some recipe for population control as well, which is Sharia compliant just as much. So these are the profiles of our three, of course, their detailed profiles would be flashed on the screen, as has been prepared by the stellar team of IRS. But I'm not going to dwell too much on that. I would first give the talking space to Dr. Sabina Durrani, who is DG Population Population Planning Wing. And Dr. Sahiba would be discussing the dilemma of rapid population growth with us today. Dr. Sahiba, you have 15 minutes. And if you need a breather, then we can request our other speaker to start, and then you can join as a second speaker, however you would feel. Okay. आप फिक्र ही ना करें, यहाँ बत्तियों का इंतजाम है और बड़ी डेंजरस बत्तियों का इंतजाम है। वो दो बत्तियां हैं, एक लाल है और एक ग्रीन है, ठीक है? तो बस वो मेरे लिए भी वो बत्तियां फ्लैश कर रही हैं, इस वजह से ओवर टू यू जी। राइट जी।
I don't have any presentation, but I think you will all उसको क्या कहते हैं, will bear with me because मैं यहाँ पे flash करने के लिए कुछ नहीं होगा, but I'll tell you. And my talk is based not only facts, तो सबको ही पता होते हैं, but I really want to tell you the exact dilemma and the truth, what exactly where we are. Yesterday, I had a meeting with the UNFPA representative. जी, no, it's okay if it's comfortable for you. जी, मेरे पास तो कुछ है नहीं presentation के लिए, तो इसलिए मैं इधर से बोलना चाहूँगी. तो उन्होंने कहा, मैंने एक बात कही कि जी sustainability of the projects, of all projects in Pakistan is one of the most important issue. वो उसने कोई लंबी कहानी शुरू कर ली, तो मैंने कहा जी एक चीजें होती है जो फाइल में होती है, जो आपको बताई जाती है, एक वो होता है जो रियलिटी होती है, और वो रियलिटी को हम मोस्ट ऑफ द टाइम फाइल में नहीं लिख ले होते हैं. तो हम एक दोबारा मुलाकात करेंगे एंड आई विल गिव यू ऑल द डिटेल्स ऑफ दैट. सो कमिंग बैक टू माय टॉपिक जी, पॉपुलेशन, वी ऑल थिंक दैट इट इज द कोर इशू, लाइक जस्ट लाइक दैट कि अगर हम कहेंगे कि एक मरीज है, डॉक्टर है, तो हम इस टाइम पे अगर हम उसको देख रहे हैं, वी आर जस्ट ट्रीटिंग द उसके सिम्टम्स को देख रहे हैं, बट वी आर नॉट ट्रीटिंग द कॉज ऑफ दैट, एंड द कॉज इज मेनली द रैपिडली ग्रोइंग पॉपुलेशन. नाउ द क्वेश्चन इज दैट रैपिड पॉपुलेशन या ज्यादा लोगों का होना, दिस इज गुड बिकॉज वी हैव मोर हैंड्स, वी हैव मोर ह्यूमन रिसोर्स. Again, the question comes that whether this population is a quality population और ये वही वाला है जो हमारे लिए security threat भी है. सबसे important जो हमारे लिए security threat भी बनता जाता है कि अब अगर आप किसी को पढ़ा भी देंगे, education भी हो जाएगी, उसके लिए job नहीं होगी, उसके लिए poverty होगी, then of course it will become a security threat. So just a background of that, you know that before 2018, there was a proper population ministry. एक क्विक सा कराऊंगी क्योंकि ये चीजें जो थी, तो एक हम कि अब हम करंट सिनेरियो में कहाँ पर पहुंच गए थे. After devolution, it became a part of ministry and the Ministry of Health, and now population is a small wing. Even though population is a national issue, but unfortunately, we are still dealing it and we are treating it as a provincial issue. It is not a provincial issue. And that's the most important dilemma कि जी कुछ चीजें होती हैं जिसको हमने nationally, internationally उसको दिखाना होता है. खैर हमारी population growth, we are unfortunately the 5th most populous country, and if this condition continue, तो हमारी इतनी ज़्यादा rapid growth है. I'm not going to detail of the numbers, like you just can't imagine कि within few years आपके पास एक और पाकिस्तान जितनी population हो जाएगी. And I think we can't afford that. जो अभी है हम उसको भी afford नहीं कर सकते. Keeping that in view, so motive action was taken by the Supreme Court of Pakistan कि जी population तो बहुत important issue है और आप लोगों ने तो इसको बिल्कुल vote किया हुआ है. And after that, on the recommendation of CCI, Council of Common Interest ने, in consultation with all 4 provinces, region, तमाम NGO, सबको मिलाकर इन्होंने एक national action plan बना दिया कि जी this is the national action plan, this is the costing, its costing was done and implementation modalities were finalized. Then comes the resources कि जी पैसे कहाँ से आएंगे. पैसों का ये हुआ कि ऑफ कोर्स पॉपुलेशन प्रोविंसेस ने ये किया था कि उन्होंने अगर अपनी एलोकेशन फॉर पॉपुलेशन एक्टिविटीज दे वर वेरी हाई, but actual spending was very low. 10 रुपए लोकेट करते हैं तो लगाते वो 50 पैसे हैं. Again, this was the biggest issue, वो नहीं कर रहे थे. Another issue, ji, which is very important for everybody to understand, that you cannot treat population family planning as an isolated issue, because family planning, I always said that family planning is a tool to improve mother and child health. Unfortunately, at all level, we have separate departments and separate people dealing with mother and child health, and some dealing with family planning. तो जब तक इनको combine करके आप एक single उसके साथ नजर के साथ नहीं देखेंगे, again this was the हमारे लिए एक बहुत बड़ा issue हो गया. अब नेशनल एक्शन प्लान भी हमारा बन गया है. देन आफ्टर दैट हम लोगों ने उस पर किया एक डोनर कॉन्फ्रेंस. बट व्हाट आई ऑलवेज फील दैट सर, resources is not the issue. This is just the judicious utilization of our resources. A lot of organization, UN agencies. Yesterday we had a meeting with END, and I was very vocal, and I mean, कुछ लोगों को मैंने annoy भी किया होगा. मैंने कहते हैं कि जी आप लोगों का जो पिछला वाला प्रोग्राम था, तो मैंने कहा जी हमारे जितने भी प्रोग्राम थे, few issues I can count: duplication, no target oriented approach, no sustainability, and no आपके उसमें आपका उसमें जो है ना एडमिनिस्ट्रेटिव कॉस्ट जो है आपकी यूजुअली इज मोर देन योर एक्चुअल जो आपकी प्रोजेक्ट कॉस्ट है. मेरे पास 1000 रुपए आते हैं, 90 रुपए तो मैं अपने स्ट्रेट अवे अपने कंसल्टेंट उस पर लगा लेती हूँ. देन हाउ कैन यू एक्सपेक्ट कि आप उसको कम करोगे? बट एनीवेज वो हमने अपने करा दिए. दूसरा उसमें इंपॉर्टेंट इशू ये है कि we don't have local, don't have contraceptives we are producing here in Pakistan, and for this we are spending a lot of our money foreign exchange to other countries, especially to India. अब इंडिया के साथ हमारे ताल्लुकात हमेशा ही थोड़े से वो होते, वो जैसे ही बंद होते हैं, then we don't have supply of long acting contraceptives. Again, then we will go to Germany, to Brazil, and they are not free of cost. तो नहीं है. एक जो चीज मैंने नोट की, और अभी मैंने इस पे बहुत उधर भी आवाज उठाई, यहाँ पर भी उठाई, in international conference on population, we are the only country where we are spending money on procurement of contraceptives. The rest, everybody is getting through donation और in the form of support के नाम से. हम लोग जो है तो हम उस, क्योंकि हम वो ना लोकल प्रोडक्शन में जा रहे हैं, ना हम उधर से कहीं से डोनेशन हम लोग लेकर आ रहे हैं. Another approach for dealing with population, because in the past it was treated like, आपने सुना होगा, खैर आप लोग तो बहुत बच्चे हो, जब हम छोटे थे तो हम कहते थे कि बच्चे दो ही अच्छे और वो वाला था. Now that narrative was not, I mean, considered by the religious scholar. वो कहते हैं how can you limit the number of उसमें बच्चों को. तो अब जो नया उस पे एक हमारा narrative है, पाकिस्तान का narrative है, this is तवाज़ुन, this is balance, because balance is the word which is not only acceptable by all religious उनके जो हमारे religious scholars है, क्योंकि कुरान और हदीस में भी ये कि आपने तवाज़ुन, एक बैलेंस अपनी जिंदगी में रखना है, and balance is I mean, very much acceptable to everybody. Now we have a forum of religious scholars, जिसमें तमाम sect के लोग हैं, because we are a Muslim country and we cannot go without their उनके involvement के बगैर हम उनको कर. So we have all the sect representative from all provinces, and another thing is media. Media को अपने साथ कराना is very important. उनको भी कराए. दूसरा ये कि if we will go to the world, और उसके हम बात करते हैं, तो ये फैमिली प्लानिंग और बच्चे और ये कॉन्ट्रासेप्टिव, इसका ये कॉन्सेप्ट आप नहीं सेल आउट नहीं कर सकते हैं. बट इफ we look into the impact of population, like its impact on climate change rapidly हो रहा है, आपकी deforestation हो रही है, आपकी urbanization हो रही है, then of course it is leading to disasters. उसका impact हो गया. Then you have economic इंस्टेबिलिटी, आटा अब कहाँ पर पहुंच गया है, जिस तरीके से हम पहले यही बात, क्योंकि अब आपके पास एग्रीकल्चरल लैंड कम होती जा रही है, उसी तरीके से अगर हम देखें, अगर जिंदगी के किसी भी चीज में देखें, यू विल नीड मोर हेल्थ केयर फैसिलिटीज, मोर एजुकेशनल फैसिलिटीज, एंड एवरीथिंग विल ऑन द राइज। सो हमारे पास तो रिसोर्सेज में कोई भी ज्यादती नहीं हुई है। अनफॉर्चुनेटली हम लोगों ने अपने रिसोर्सेज को एक्सपैंड नहीं किया है, लेकिन हमारी जो पॉपुलेशन है वो इतने ग्रोथ के साथ है, जो हमारी जो हमारी अवेलेबल रिसोर्सेज है, हम उसमें नहीं उसको पूरा नहीं कर सकते हैं। Few days back, I had again meeting with all the stakeholders, including our donors, including our implementing partners. Everybody was there, sir. And मैं जब अभी सर आपसे मेरी मुलाकात हुई थी बिफोर गोइंग टू थाईलैंड, और उससे मैंने जो वहां पर एक वो, बिकॉज दैट एक्सपीरियंस आई रियली वांट टू शेयर दैट विद यू, कि जी दुनिया वाले हम किस पोजीशन में हैं। यहाँ पे तो बड़े बड़े बैठ के हम बड़ी बात कर लेंगे, बट एग्जैक्टली वेयर वी आर। जब मैं आई तुमको ये मेरे अल्फाज थे, मैंने कहा जी खूबसूरती में हम बहुत अच्छे थे, स्टाइल में हमारा कोई मुकाम नहीं था, अंग्रेजी बोल रहे थे, तमाम एनजीओज वर देयर और बड़ी बड़ी बातें थी। और लेकिन मेरे साथ जो डेवलपिंग कंट्रीज थी, जो हमसे भी पैथेटिक हालत में नॉर्मली वो वाली हैं, जिनको अंग्रेजी भी नहीं आती, जो शक्ल से भी हमसे अच्छे नहीं थे, जो वो वाले, उनके जब इंडिकेटर्स आए तो यकीन करें आई वाज रिग्रेटिंग कि मैं क्यों इस वाले कॉन्फ्रेंस में आ गई हूँ। उनके इंडिकेटर्स, हमारा कॉन्ट्रासेप्टिव प्रेवलेंस रेट 34%, वो बात कर रही है 90%। मतलब दिस वाज, और वो वाली कंट्रीज है जो हमसे बहुत खराब है। एक और चीज आपको, हम इस्लाम को लेकर आते हैं, इस्लाम की बात करते हैं। इस्लाम में हमारी मुल्क की खवातीन जो है, लेस देन 50% ऑफ द वुमेन वो ब्रेस्ट फीडिंग कर रही है। ब्रेस्ट फीडिंग इज अ नेचुरल वे ऑफ बर्थ स्पेसिंग के लिए होता है। हमसे जो नॉन मुस्लिम कंट्रीज है उनमें भी जो ब्रेस्ट फीडिंग है, दिस इज मोर देन 80 and 90%. So where we are we following the Islam or are we following the यूरोपियन और बाहर का डेवलप्ड वर्ल्ड एजेंडा? मतलब हमें तो लगता है कि जैसे हम बीच में ही कहीं पर रह गए हैं। तो एक वो वाली, तो मुझसे जो मेरी आईपी से मुलाकात इंप्लीमेंटिंग डिपार्टमेंट है, प्लीज अब आप लोग जो है ना, ये खूबसूरतियाँ, ये जो आपकी हमें जो फिगर्स बताते हैं, नाउ वी नीड टू हैव अ टारगेटेड अप्रोच, अदरवाइज आई एम नॉट गोइंग टू अटेंड एनी सच, बिकॉज इट्स अ शेम फॉर अस कि हम वहां पर जाएं। एक और वहां पर भी सवाल हुआ, एंड इट रियली अनॉयड मी ऑल्सो, एंड फॉर्चुनेटली मेरे साथ एक सेनेगल का बंदा बैठा हुआ था और वो फ्रेंच जानता था, तो वो फ्रेंच में तो मुझे जल्दी जल्दी बता रहा था। और ये जो था, ये आई वाज रिप्रेजेंटिंग जो हमारे मिनिस्टर साहब की जगह पर मैं गई थी, तो ऑल मिनिस्टर्स वर देयर। तो उन्होंने एक सवाल किया कि जी वुमेन हैरेसमेंट, सेक्सुअल हैरेसमेंट, वुमेन जो मतलब हमारी खवातीन की जो सारी बुरी बातें थी, तो व्हाट अबाउट दैट, कि जी औरतों पे तो बड़ा जुल्म होता है आपके मुल्क में, और आप लोग तो पता नहीं क्या कुछ हो, जैसे हम बिल्कुल एक कल्प्रिट आकर बैठ गए हों। तो मेरे उसमें 2-3 मैंने उनको जवाब दिए। मैंने कहा जी ये जो आप एटीट्यूड बना रहे हैं ना, ये सिर्फ हमारे मुल्क में नहीं है, दिस इज अ ग्लोबल फिनोमेना। इवन आप डेवलप्ड वर्ल्ड का भी आप वो करा दे तो क्या ये चीजें, अगर आप वुमेन रेप की बात कर रहे हैं, वो कर रहे हैं, तो वी आर नॉट, दिस इज नॉट स्पेसिफिक टू पाकिस्तान, एंड सच टाइप ऑफ एटीट्यूड इज नॉट एक्सेप्टेबल एनीवेयर इन एनी सोसाइटी। अगर हम उसमें फैक्ट्स पर आते हैं, अगर मैं पहले फिर अपने इस्लाम को, अपने मजहब को लेती हूँ, तो आप सबके मजहब में भी और मेरे मजहब में भी वुमेन इज वेरी मच वेल प्रोटेक्टेड। मैं लॉस पर आती हूँ तो मेरे पास लॉस भी है, लेकिन मेरी बातें मे बी नॉट इफेक्टिव, बिकॉज व्हाट आई एम टेलिंग you may or may not agree with me. My point is that please come to my Pakistan and see the real picture of my woman. It's not only the weeping, एक खराब, एक pathetic, जो हम लोगों का एक ये भी डायलेमा है कि हम पैसे लेने के लिए हम जब बाहर जाते हैं तो हम अपनी औरत को इतना गंदा कर लेते हैं कि जी बस पता नहीं हमारे मुल्क में हमारे मुल्क उसके साथ क्या कुछ हो रहा है। तो दीज आर द थिंग्स कि हम उसको कम से कम अपने इंटरनेशनली अपने इमेज को थोड़ा इम्प्रूव करने की बहुत ज्यादा जरूरत है। और उनको मैंने कहा जी हम नेक्स्ट रीजनल कॉन्फ्रेंस यहाँ पर करेंगे और मैं इसमें तमाम मेरी मैक्सिमम खवातीन होगी, तो आप सिर्फ उनकी खवातीनों की उनकी वो ना देंगे कि जी उसके साथ उन्होंने ये किया। मैंने ये सारे जो हमारे मुल्क में होते हैं ना, तो ये सारे एंड बिलीव मी एवरीबडी वाज सो, मतलब उन्होंने अप्रिशिएट किया जो वो वाले सवाल को कि जी हाँ एग्जैक्टली कि हम एक खास मुल्क के साथ उसको क्यों लेकर आ रहे हैं। नाउ कमिंग बैक, मेरे ख्याल में थोड़ा टाइम रह गया, जस्ट बस मैं दो बातें ये वाले कि जी पॉपुलेशन इज अ क्रॉस कटिंग इशू, it is not, please, it is not just family planning, and it must be dealt with through multi-sectoral approach. Otherwise we will be again sitting here doing the same thing, बातें करेंगे और यही हालात रहे तो हमारी हालत और भी खराब हो जाएगी। थैंक यू सो मच जी।
Thank you very much, Madam, for such a frank and open appraisal of this. And I'll take your last concluding line as the main crux, that any of the issues our eminent speakers for this session are going to highlight are cross-cutting and need to be dealt with a multi-sectoral approach. And that is how non-traditional feeds into the traditional aspects. And we are not only looking at the problems through a Pakistani lens, we're also looking at these issues from a regional perspective. And unfortunately, the indicators that you pointed out at the international level are also pretty alarming for Pakistan at this point at the regional level as well. Not that I have much hope, but I'm quite sure that both our respected speakers would paint a nice picture. Nicely worded picture, even if it is a very dismal one. My next eminent speaker for today is Dr. Shamail Daud Arai, who is the Chief Executive Officer of Maria Memorial Hospital. Many of you may be familiar with that particular hospital when you are moving through Rawalpindi's main artery, and he's also the former president of Rawalpindi Chamber of Commerce and Industry. Dr. Saab would be dealing with dealing with the necessities of education and health. And just before he came to the stage, we said, please also look at poverty, because one of our speakers has somehow not been able to join. So you're also going to be looking at poverty. Thank you so much, sir.
Thank you so much. Being a medical doctor by background, I guess I'll perhaps be biased towards healthcare. So I was looking at today's discussion more so on the importance of healthcare as a non-traditional security threat for the country and the region. And obviously, I'm not an academic, so my perspective is from a practitioner standpoint. As mentioned, I've been affiliated with healthcare service from the private sector side for almost 25 years. So I want to mention that beginning of this last year, in January, the government of Pakistan published a vision for the country's first ever national security policy document. And it was very important from our standpoint because for the first time it covered many things, but one of the points, or the 6 main points, was on human security. Which highlights the state of Pakistan's challenge to manage not only, as Dr. Durrani was mentioning, the vast young population or the population itself, the vulnerabilities and health sector, and the impact of climate change, which we have all witnessed recently, food security challenges, which we are witnessing even today, and the need to adopt a gender-focused security approach. So that is why I think other than other traditional security issues, for the first time, the state of Pakistan has really focused on healthcare and has realized that this is a non-traditional and an important element. As far as our healthcare is concerned, Pakistan's healthcare is by and large public funded. It is, we see all around the country, about close to 1,300 hospitals. We have a whole list of basic health units, tertiary care, secondary care, teaching hospitals. So as far as the infrastructure is concerned, we have actually a good public health infrastructure, which is spread all over the country. But when we look at it, when we look at the indicators, when we look at the performance, we somehow end up with a dismal condition, be it, trying to achieve under the WHO indicators or sustainable development goals. We see that our performance is kind of at the bottom of the global scenario. So why is that? Why is that case? Obviously, there are priority issues, as I rightly mentioned, that there wasn't a focus. So what is the expenditures? Are the expenditures enough as far as Pakistan is concerned? We have consistently been spending on the lower side as percentage of our GDP. It's always been close to 1.5. I think 1.2% is probably the highest figure that we can say. It has been increasing. I wouldn't say that in the past couple of years the government has been increasing, but it is merely the amount of money that is being expended by the government as part of the budget, as part of the GDP, is very low. So per capita, we're spending about $45 per capita, and out of which $14 is coming from the government side, and a larger chunk, more than half of the chunk, is coming from the out of pocket. So people are paying for their healthcare, be it medicines or their needs, out of pocket. So that is despite having a huge infrastructure of, as I mentioned, basic health units and secondary level hospitals and tehsil headquarters. And we also have to mention that we have a rich presence of social security. There are other entities that are providing services, and for that matter, an interesting figure that about 39% of the total footprint in terms of the public health goes from all of these organizations which secure healthcare for the public. So the story is that most of the population is still reliant for their health needs, more so about 60% or so out of pocket. And that means that there is a burden on them with where we look at it from the poverty side. When they do not have any savings, catastrophic coverage becomes an issue. It puts these people and the families at risk, and at times they completely are ending relying on debt or selling their assets or whatever assets they have, specifically the communities that live in the rural side. And because there is a divide in terms of the infrastructure is there, but there are ghost basic health units, there are ghost rural health centers where they're not, they might have the buildings, they might have the infrastructure, but they do not have the human resource, or the presence isn't there. There are vacancies that have never been filled. And so those people are reliant either to go to traditional healers, quacks, and so forth and so on, or they would have to travel for large distances to come to the city. And so we see overrun tertiary care hospitals, teaching hospitals in the major cities, and that is where that delay in healthcare and the extra burden is passed to the public. Having said that, the indicators, unfortunately, as I mentioned, after all this expenditure, are not really positive. If we look at it, the regional standpoint, we are behind India. Obviously, we're behind Bangladesh. Neonatal mortality, we have second highest in the world. It's about 40 per 1,000 births. We, despite being a poor nation, despite having all these issues in terms of access, on the other side, 22% of our population is obese, which is surprising. On on the because of our consumption and our behavior. In addition to this, obviously, all other healthcare indicators are not going very positive. We have now the highest population in the world in terms of hepatitis C patients. HIV, we are adding 25,000 new cases of HIV every year. We have about 190,000 or so. Tuberculosis, which has been wiped off from many countries, we have about 510,000 patients that are affected by it, with drug-resistant tuberculosis patients, about 20,000 patients are those. So these are the sorts of ground realities which are facing us as a country. And because we recently passed through the COVID era, that also kind of was an eye-opener, not only for us, but for the rest of the world. And likewise, we found out that we are not only vulnerable, but we are dangerously vulnerable. Right now, in terms of the Global Health Security Index, which looks at how prepared Pakistan is in the region in terms of our pandemic or how to deal with it, we ranked about 130 out of 195 countries, whereas our neighbors are way, way down. They're in 40s and 60s. As far as the population is concerned, as Dr. Durrani was mentioning, our contraceptive prevalence rates is about 60% or so. Sorry, 30%. 60% is Bangladesh. So, so those are the sorts of things that are leading to a very dismal situation. The overall approach from the government, the federal government, has always been very proactive in writing plans. We were perhaps one of the first to accept that we are going to participate in the Sustainable Development Goals. We have a health vision, we have good reports, but there's no implementation. There's a disintegration between the provinces, because now healthcare is a provincial subject. So the vertical programs run, most of them are running from the federal side, and a lot of there are disruptions in the provincial side in terms of healthcare vertical programs that have to do with all sorts of hepatitis and HIV, dengue, and so forth and so on. So this disintegration results into hiccups, and our reliance on the district health management team is there to provide, and still technologically we have the only advancement we've had is that we are uploading indicators on a dashboard. That's about it. But more than that, we are not really utilizing technological advancements, which a lot of other countries are now taking advantage of. So having said that, COVID was an eye-opener, as I mentioned. Why? Because it kind of like told us that the curative approach is not going to help us, because whatever beds, whatever infrastructure, whatever hospitals and healthcare facilities we had, or doctors and nurses, whatever we had, although our ratios are not up to the WHO standards, we're not spending as much. We should be spending 5% of our GDP in terms of the healthcare. But the eye-opener was that the curative approach is not going to help us as going forward. So the only way we can really address this challenge is by having a preventive approach, by having more focus on whatever expenditures we're doing publicly or out of pocket. We need to go towards a preventive side instead of curative side. And that means primary healthcare should be the way to go. We should focus that. But the government or the federal or the provincial focus has always been more so on the curative side. And that's why you see huge hospitals. It sends a huge signal of infrastructure, and it looks nice. Universal healthcare, I think that the Sehat program or the health card program that initially it was started in KPK in the last couple of years, where the focus was on marginalized families and poor families and supporting them. It suddenly mushroomed into universal healthcare for the whole country. And originally it was doing well in terms of providing access in trying to provide social insurance for or catastrophic coverage for a lot of those families that would be burdened. But then it went into a different mode, a political mode, and it lost its flair. It lost its main purpose. So if I can if I can conclude, for us going forward in terms of healthcare delivery and able to step up to the challenge of the rising population, which is going to be, 350 million by 2050, the way it is going, we will really have to change gears and go towards a curative. It's a paradigm shift where we will have to prioritize, first of all, increase the expenditure. So as I said, $45 is being spent today. We need to bring it up, according to estimates, about 86. That's an optimal level of expenditure. So we would have to spend about 18 billion US dollars in terms of reaching that 86 figure for our population as of today. So that is increasing the expenditures for the out of the GDP, going up to maybe 4%, 5% of the GDP. And at the same time, focusing at the paradigm shift is towards primary healthcare. Universal health coverage cannot be done, but focusing more so in this initial period till the economy picks up is to focus on marginalized and provide social insurance and pooling of resources. And this way we can really go towards preventive versus curative, palliative and rehabilitative approach, which can then help us really navigate our way through this healthcare, which is really a challenge. Obviously, talking about from the poverty side, we have these issues from the rural community side where, children under 5, we have the highest figures, not only about education, because stunted growth, mothers who are more than 40% mothers are iron deficient, and that results into, pregnancies. On average, a woman is about 3.6 within the childbearing age. The number of children she's going to bear is about 3.6. That's on a higher side than with iron deficient, and then not having the necessary food and malnutrition, resulting in stunting growth in children, and then that definitely decreases our output in the GDP, in the gross national product. So these are the sorts of challenges that we really need to look at. And this is a threat that is definitely going to overpass the traditional threats that we have been putting aside a large chunk of our economy. And recently, another eye-opener obviously was, as we were talking about cross-cutting issues, was the climate change, which has then again put a burden on not only the rural community, but also on the healthcare sector, which was already at the margins. And it wasn't able to, and it has actually created huge issues. I think a lot of those issues are not being talked about in the media and so forth and so on, but we did see those private sector entities that have been on the ground and working with the community have been sharing their stories, how vulnerable these population, childbearing women, every month 600,000 women were the ones that were expected to deliver, and every month about 150,000 women were delivering, which since the flood have been. So providing them antenatal cover, providing them the guidance, and providing them the nutrition so that they do not end up bearing another stunted child or having a high mortality, neonatal mortality. So these are the sorts of challenges that we are facing, and with this cross-cutting thing, the only way for us is to have a synergy. And I must add, because I'm from the private sector, typically within the whole scenario, private sector is not considered as a stakeholder. It is not considered as part of a solution. It's always looked at in the prism of a problem. Whenever we're discussing healthcare, education, or any other segment of the state of economy, we don't look at it as how this can become, a supporting element to our problem. I suggest and I submit that a large chunk of the private sector is, again, curative, and it needs to factor into the healthcare financing, the resource allocation, pooling of resources, and also the preventive side of primary healthcare, also on the side of, and we saw this recently in COVID as well, where the diagnostic side, the vaccination side was initially actually bridged the vacuum which existed was bridged by the private sector. So why not now going forward, putting it together with from the preventive side, primary healthcare side, and developing a synergistic mechanism, because as of today, a maximum population is ending up at the doorstep of a private health care provider. So I hope this works for further pushing the dialogue. Thank you.
Thank you so much, Dr. Shamail. That was an excellent continuation of the diagnostics coming from Dr. Durrani, and you looking at it from a very well-connected, yet an independent perspective. And I think a lot of that has also to do with our culture, where we are very much wedded to a very resilient, yet a very resistant mindset in which we fail to accept several things. And moving from curative to preemption is something that, including myself, none of us would do. We won't even introduce healthy food culture in schools. So if you do that, many things may change. So this is something which is, again, very holistic, and we need to look at it from that aspect. My deepest apologies to my panel, because we are pressed for time and we have several other people waiting for us, and I love to talk. So I'm going to hit upon your talk time as well, but we have 15 minutes allocated, and unfortunately, we cannot benefit so much from your wisdom as we would love to. Any of the presentations which are being provided here actually require a minimum of 1 hour of deliberations and discussions, and they're so rich in their flavor. Our last speaker for today is Engineer Ehsan Javed, who is a research fellow on SARC, or from SARC Secretariat on renewable energies. Engineer Sahab's profile is available for all to look at. And over to you, sir, for giving us a solution how to save ourselves from load shedding.
Thank you very much for giving me the opportunity. So I'll just briefly try to build upon what Dr. Saab already said about the increase of the population and the problems associated with it. So energy sector is basically the direct, has a direct link with the population increase in the country. I mean, if the population increases, so does the demand of the energy increases in the country. So for government of Pakistan, I'll just give a brief overview of the government of Pakistan, what it is trying to do to curtail the energy shortages, since energy is such a big sector that it needs the support of the government, along with the investment of the private sector, definitely, but government intervention or support is definitely required. So the government of Pakistan basically strives to give a technology or any energy sector in terms of the affordability, sustainability, energy access, and the energy security. These are the 4-5 major concerns which are given consideration before deciding a technology which has to be implemented in a country, whether it be a coal, oil, gas, or renewable energy. So our government is very clear on this one, that we need to go for a affordable, clean energy resource in the country. So for that, there are basically 2 policies which are effective right now. One is the National Electricity Policy and the ARE, Renewable Energy Policy 2019. So both these policies strive to work for a optimal utilization of indigenous resources, integrated planning approach, efficient and a competitive market design. So to achieve this, basically energy sector, you can divide it in 3 sections. First is the generation side, second one is the transmission distribution side, and the third one is the end user side. So I'll just briefly touch on the generation side first. So on the generation side, our government plans to reach 20% to 25% of renewable energy by 2025 and 30% by 2030. To achieve this, they have to check out the solar, wind, biomass, all these technologies which are commercially viable, which have easy access, which have resource available in the country, and just to tap these potential into the reality and in terms of projects. For that one, previously the government of Pakistan was going through different modes of project financing. into 1980s, 90s, government was funding those projects. Then in the later stages in 2001, it initiated a concept called feed-in tariff, whereby the amount of electricity you generate, you just feed it into the grid and you get the price for that one. Now the government is going for competitive bidding, which is basically in a layman term, simply as you just say that there's a site and we want to build solar wind farm on that. And for that, we ask the bidders just to quote prices on that one. And the lowest bid quoted by an investor is given the project license, and it just develops those projects in those sites. So the government is going on this mode right now. So for that one, I was yesterday speaking with Dr. Saab on at a dinner time, and I was saying that the problem with the government plan is that it works, it seems very good on paper. I mean, you look at all the policies of the government, Pakistan has been producing for renewable energy or other technologies, but the problem is on ground implementation is not up to that mark. For example, the government was saying that we will achieve 9,000 or 9,500 megawatts of wind and solar by 2012, but it has not been able to achieve above 2,000 or 2,500 megawatt up till now. So imagine the target was 9,000 megawatt to achieve in 2012, and by 2022 we are still laying on a meager 2,500 megawatt of solar and wind combined. Now let's see an example of our neighborhood. India started its wind program after us. India started its solar program after us. Nowadays, India is sitting on a 41,000 megawatt of wind and 60,000 megawatt of solar. So imagine the amount of progress they have made in 20 years, and where are we lying? I mean, we have been speaking to these Indian delegates, and they were appreciating the policies of our OGRA sector. The Oil and Gas Regulatory Authority has been very good in implementing policies and giving these good regulations. And they were telling that we were looking at the policies of OGRA and devising our policies based on them in early 2000. And right now they are exporting oil and gas to Bangladesh through pipelines. They are exporting oil and gas to Nepal. And where are we right now? Our government has been pursuing different technologies. After every 2-3 years, every government comes, it blames the policies of the previous government, it gives a new policy. Then the next policy comes after 2-3 years. So the one point which I wanted to make is that we need to go for a consistent policy. I mean, if there is a policy given by any government, you need to evaluate the shortcomings of that policy after 3-4 years. That's what developed countries do. You evaluate mistakes, and based on those evaluations, you try to rectify those mistakes in the next policy. It's not like every other 3-4 years you give a policy, and the policies are basically the copy paste, the text, sorry to say that, but they are just copy pasting of the previous policies. Like, we will promote renewable energy, we will give emphasis to clean energy, we'll achieve this target, but what has happened in the last 20-30 years? We need to seriously sit and evaluate what were the main shortcomings of that one. So this was the generation side. On the transmission side, so the problem is that once you have generated electricity, for example, you have generated 20,000, 25,000 megawatt, to transmit that electricity from the generation plants to the house, it takes losses. Normally in developed countries, the losses are lower than 5%. Our losses are in range of 25% to 30%. So imagine if you are producing 100 megawatts of electricity, just a rough number, for example, you are giving your homes approximately less than 70 or 65 megawatts of electricity. The others are lost in the transmission losses. Now, there's a very important point that out of those 30%, the technical losses are not more than 1 or 2%. Maximum are theft losses. So what do? We say that there are those electrical losses, we need to revamp those transmission lines, those grid stations, we need to make sure that they are more energy efficient, but it's just very small peanut in comparison to the theft which is happening in the regions of different, like I won't quote those utilities which are having those large percentages of theft. So the governance has to improve in that area. You need to curtail that theft. Unless you do that, you keep on generating more and more power, it will keep going into that wastage. So one thing is that one. The other point is that I would also like to blame the government on this one, that once you know that the problem is with the transmission and distribution side, you are planning to increase the generation more and more, but your system cannot support a certain amount of electricity. So why you are not investing on the transmission and the distribution side? Why? Because there are no ribbons being cut during those transmission and distribution projects. Ribbons are only cut during whenever a generation power plant is installed on ground, and then you cut those ribbons and you go for your whatever political gain, something like that. So in real terms, they are not working for the real issue right now. On the end user side, so end user side, for example, what we as nation, what we can do is that we have been speaking a lot about the energy efficiency measures, the demand side management. Nowadays, there are technologies available and installed inside the homes, and it's not a very rocket science. But for example, I'll just quote few things, that washing machines basically is a heavy load equipment, and you can't run those washing machines in your peak hours. You can, just by changing your behavior patterns, you can use those heavy loads in times of off-peak timings, whereby cheap electricity is available. So you have two benefits. You consume electricity in cheap tariff modes, plus on top of that, you are also lessening the burden on the electrical grid. So there are different gadgets available. And those are very low-cost gadgets which are being implemented in our neighboring countries, Sri Lanka, India, Bangladesh. So they have already installed these type of gadgets at their homes level, at their industries level, whereby cheap electricity is consumed on heavy load side, whereby you can, just by behavioral change, you can improve that one. So these were common few points on the energy generation and transmission and the end use side. Lastly, I would speak a little bit about the energy trade. Energy trade interconnectivity is very important for our region. For example, no country in the world can survive on its own. It also goes for the energy side. I'll quote an example that we have been laying at a very good strategic position, whereby we are connecting Central Asia with South Asia. Now, our neighboring countries on the eastern side, including Nepal and Bangladesh, they have been asking us on multiple times that cheap electricity from Central Asian countries is readily available, Kazakhstan, Uzbekistan. So why not import that electricity back from their countries and then shift it over to the eastern side? Similarly, cheap electricity, if it is available in certain months of the year from the eastern side, it could be transported back to our side and on the western side. And just to give you a small example, that India has been in an arrangement with its neighboring country, Bhutan. Bhutan has excess of electricity in summer times because it has got a huge resource of hydropower potential. So they generate that cheap electricity of hydropower in summers, but their demand is not high because it's a cold country. So it transports that cheap electricity to India in summers, whereby India requires more electricity in summer. On the winter side, when Bhutan requires more electricity and the rivers are not flowing in at full capacity, so it gets its electricity back from India in those winter time when India does have lower required electricity. So these type of arrangements are not happening here. It are happening everywhere around the globe. The Nordic grid is also transmitting power within its own region. Sweden, Denmark, they are also transporting. They have a regional grid over there. So similarly, in South Asia, we need to go for competitive bidding. We need to go for the regional grid, whereby all the countries, neighboring countries and our region can benefit from the cheap electricity which is available. And secondly, so I think I'll just stop on that one. If there is any comment, I can just answer that one. Thank you.
Thank you, sir. The time hasn't, light hadn't turned red as yet, but that was a very efficient use of energy in all circumstances. And I really hope and pray that we do end up having a regional vision when we are addressing such pressing problems. But unfortunately, where SARC as an entity has not remained very viable in addressing the main issues for which it was tailored, it has also led to a situation where the region of South Asia by itself is not looking very regionally. It's always one minus the rest. And where the politics play a lot of role in that, that is also eating up on our shared resources and our shared vision. And of course, there's a drastic lack of vision and implementation when it comes to these aspects. One very important and pressing point when we are looking at these very pertinent problems of energy, resources, food security or insecurity. Nowadays, the buzzword is climate insecurity. Any of my students who want to do a paper, the first thing that they think of is climate insecurity, and then they think of CPEC. And for neither of the two, we have any different approach to look at or anything innovative. We are just mimicking, as Dr. Shamail and as Engineer Saab had also said, that we are just reinventing the wheel over and over again. And there's no innovation in thinking and no out-of-the-box approach. Perhaps we don't even need an out-of-the-box approach. We just need to be introspective and realize where the mistake lies and address it accordingly and adequately. But a very important aspect that has been highlighted by all our speakers in what they have stated are the Sustainable Development Goals and the fast approaching timelines of the SDGs. When we jumped the gun and we readily passed a bill of implementing the SDGs in the 30-year time frame, and we stand nowhere close to any of the benchmarks that comes with that, which is very unfortunate. Although I would love to ask and engage my panel with questions from me, but I think we have a very rich audience sitting here who would have a lot of questions, who would have comments. My request as a moderator would be that please economize on the comments and do ask questions, but one-liner questions at best. And none of the questions should have 3 sub-questions to be followed by 3 more sub-questions to that. So if any of our learned audience has questions from our speakers, kindly address the speakers and feel free to ask the question. I would request, because we do see some non-Urdu speakers in the audience, that preferably the mode of communication should be English. But if anyone is hesitant, feel free to speak in Urdu as well. Thank you so much. कोई बात नहीं मैडम, it was multilingual. मुझे समझ आ गई, ये बहुत बड़ी बात है. Perhaps you don't know how challenged my English is. So, anyone who has a question from any of our speakers? Ambassador Shah Jamal.
I have a question each for the 3 panelists, starting from Dr. Saiba. Dr. Saiba, it's very heartening to learn that we finally have a national plan of action for population. You said that Pakistan is the only country which is importing contraceptives. I would like to know from you, what are the types, what products are we importing, and what is the amount we are spending on it? That is the question for you. Sir, with regard to the population and health and education, I would like to know what your recommendations are, because for health, you have said that 5% should be spent of the GDP. On the education side, you have been little evasive. So what recommendation would you have for the education sector? What areas that we are neglecting, which needs more focus? So with regard to the energy thing, we already have additional installed capacity, and we are required to pay to them, the IPPs, even if we don't use that. Keeping that in the back of mind, what future plans can we have? Our Prime Minister is jumping over the roof for solar energy. Is it practicable in this time? Thank you.
Sir, we are importing long-acting contraceptives, number 1. We are producing injections and the pills over here in Pakistan, but not only, but not the long-acting contraceptives, particularly from India, as I said that. And the amount which we are spending, as I said that now it is population is a national issue, but we are dealing it as a national issue right now. And the provinces, what they are spending, it is not unfortunately visible to us because they are giving us the allocation of their budget. But if we actually see into the spending is much lower. Now, right now, currently, the Sindh is the only province which has, I don't have exact figures of that because this time I've involved the international pharmaceutical companies also to give us a detail that what will be the cost of that. But at the same time, we are also planning to explore markets other than India, Brazil, and Germany. Because in China, and here comes the role of our MOFA also to help us that how can explore the other market also. So, sir, I'm just in the process of that. Another thing is that we are involving the pharmaceutical companies also for local production of these things. But last year I had a meeting with local pharma and their demand was just that कि half of the Pakistan unko de de just to produce that. But their demand was unrational sort of that. So what you are asking, it is just in the process. And I can't give you the exact figure that how much we are spending. But just one important thing is that for population management, long-acting contraceptive is the only choice. The one which we are spending, the injection Norigest, it is not the choice. Even for short-acting, we are importing it from Bangkok, the condoms. Let's check into that even those small things, we are not producing that. So this is, I mean, it's a very alarming thing for everybody. And what I said, that it's a multi-sectoral, all the ministries must act together. Otherwise, because for that we need the support of MOFA and other ministries also.
Are you satisfied with the awareness which is being given?
Yes, of course, we are, because after the so moto action taken by Supreme Court, everybody's they are afraid that one day the Supreme Court and the Chief Justice has asked them to give the report. And recently, yesterday, I received a call from the Chief Justice of Pakistan that in March they are going to hold a symposium. That the so motive action, the national action plan, costed plan, now what's the situation in that? And I'm very much clear, I will tell him all the difficulties without hiding anything. I know it is not going to be good for me, but definitely we need to discuss the issues along with their solution. Of course, yes.
Obviously, we are not importing a lot of our pharmaceutical products, and the active product or APIs, we're importing most of it from China. We were importing from India as well, or other countries, European countries. So that obviously is an issue. And so anything we want to do, be it population planning or, if we're trying to do anything in energy or in health, we are reliant on import. And with the balance of payment issues, again, it becomes an issue that we want to solve this problem. In order to solve this problem, we are not relying on indigenization and local production of that product, whereas we can produce it. We have the capability. We just do not have the will or the intent. So a lot of issues are because of this, and that becomes a challenge where the rising prices and the devaluation of our currency, it becomes a challenge for us to import it, where our revenue generation, we have huge gaps. As far as education is concerned, other than health, obviously, I mean, everyone knows that we have the highest number of children out of school. For me, I think out of the box solution is that whatever infrastructure we have, we need to repurpose a lot of our expenditures from non-productive expenditures, things that are, as rightly said, that we just need to look and analyze what we have been doing. If we have been expending on something and the output has been on the lower side, we need to stop doing that. That's just common sense. It doesn't require another PhD or some consultant from outside to come and tell us, and then we have to pay him or her. But So that is the sort of thing. So I think, in my view, in terms of education, a lot of the African countries, a lot of other developing countries have used technology and not relying on infrastructure, but delivery of education to the poor and not relying on the typical infrastructure. I think the capability is there. Intent isn't there. Repurposing of the existing resources needs to be done. Obviously, the number of teachers still, or the human resource, or the trained manpower, those are not there. I think just sheer numbers is the issue here, the challenge. The qualitative aspect will come later in terms of education. For now, I think just trying to get those children who are from marginalized families, who are poor, who just do not have access, is bringing access to them. But since we have such huge success stories in Africa where children without rooms or in open spaces with the help of technology have been getting, not only they're getting education, but their results and outputs are marvelous and at par with any good educational system with a typical infrastructure and everything. So we have to get out of this. And if we get out of this paradigm, relying on infrastructure and ribbon cutting, I think we will be able to do a lot more with the existing resources. So that's my little bit on the education part. Over to you.
Which you mentioned was that since we have excess power, so why are we going for renewables? The problem is we don't have excess power. Right now, we don't have the means to transport that power to the end user. That was the first, I've already explained that one in my in my earlier talk. Right now, the power plants which are running on oil, gas, and coal, they basically require fuel to be imported into the country. That is putting a burden on the national check. So what renewable does is that there is free source of energy available. You just have to tap up the free resource using solar or wind. So that is nothing, right now, very technical thing, in a sense that you don't need to implement renewables. Are not all the global countries are going towards renewables. Regarding the question on why they are going for solar in Pakistan. So the solar in Pakistan, basically the government is trying to offset the demand of those public buildings which are consuming huge amount of electricity. That is not feed it into the grid through on-grid power plant, but that is you install those solar panels on the rooftop of those public buildings. The same way houses are installing solar panels on their rooftop, and that is to reduce the amount of energy required from the national grid. So even if you are requiring 100 units of electricity per month previously, so with that solar panel, you may require 20 or 30 units of electricity at peak times. Off-peak times are basically covered by the solar. So that intervention is just to reduce the amount of electricity required. I think those were the two questions.
I believe we should be finishing our session at 11:30. So we'll have at least one round of questions with very short answers. So.
My question is with Dr. Shumar. Most of our population is in rural areas, 65 to 70%. And government has established rural centers in the towns and in the bigger villages. I was carrying out research and I have visited those in Azad Kashmir and in Punjab and in Sindh, some of the rural centers. The doctors, they do not want to be transferred to those centers. So if there were 4 vacancies, there was hardly any one doctor. So this is the problem. So this problem, how it can be sorted out so that the doctors are employed in those rural areas. This is question to Dr. Shumar, and then to Dr. Durat. The second question is family planning. Again, the population is in rural areas, men and women, either they are shy of talking to each other about family planning and all that. And most of them, they do not know the family planning exists or what is it and all that. There is a provision in the rural center like lady health visitors. Matured ladies, trained, educated religiously as well as medically, if they visit the villages and they educate at least the women, then the family planning systems can be improved. There are so many models available like Bangladesh, India, and so many other developing countries. They have done it, but we are unfortunately have not been able to successful. So what are your comments?
पहले अब मैं अपना जवाब देना चाहती हूँ सर वी डोंट हैव इवन हमारे पास इट्स नॉट ओनली द LHVs we have community midwives under community midwives heading we have 7 different cadres under working under the health wing and the population wing. These are family welfare worker, family welfare assistant, family welfare counselor, LHVs, LHWs, we just named them. We have, this is the disintegrated program, and their presence in the community is always there. And the only thing is that on one side of the road, people from population will be sitting over there, and on the other side, the health, the LHW, and they will be sitting there. But the question is that everybody their approach in the community at the community is very much there, and it's not only the public sector, the private sector. We have a number of NGOs who are working there. The issue is duplication. For example, if I have this is my universe, and I will have to cater 100 people. For 100 people, I would love to spend all my resources on these 100 people instead of going into other area where there is actual need. So the thing is that the project implementation, the delivery implementation, it not should be as per my ease. My projects are not required in big cities like in Peshawar, but I need I need the people to go into the more suburb area where healthcare facilities are not available. And same is the issue in RHCs, because RHCs are there, all the infrastructure is there. Dr. Shumail just mentioned that government spending on health is very low. No, I don't believe on that. The health is government spending is about health is government spending on health is much more high, but this is only the disintegrated approach. Now, after devolution, health and population, if we will not deal both these issues as a single entity, the same question and the same issue will arise all the time. तो हमने यही अब किया है कि जी हमसे क्या है. और एक और चीज सर, this is I'm taking more time, but this is important. In Pakistan, we have 60% of the area which is covered. Covered means healthcare facilities are there, and 40% is uncovered. For 60%, this is not fully strengthened or operationalized. The need is that to operationalize that 60% area through public-private partnership, because public sector is providing 70% to the people. मतलब public जो हमारा private sector जो है वो 70% reachable है to the people. So for operationalization of that 60% area, and for uncovered area where government existence is not there, NGOs are there, the private sector is there. So public-private sector is the only solution for that. So this is all from my side, Ji. Thank you.
Your question about rural health centers and everything, I think what we have to understand, and I just want to impinge upon a little bit on the population as well. You see, it's not about just imparting the information to, so there are Lady Health Workers Program, which has been there for a long time, and community development workers are there. When that information is passed to the household, to the women, she is not completely in charge of her decision-making. And that becomes a challenge because it's a power struggle within the community, within the household. She doesn't make her choice. Somebody else does. And there is resistance. And I rightly agree that obviously, similarly, like us, Bangladesh had similar challenges about people being shy and everything. Their population today is 165. Their life expectancy is above 75 or something like that. We are about 67 on average, 69. I think women are higher a little bit. So I think we have used cases, we have successes in the South Asian region, in India and Bangladesh, where similar, information, similar situations are there. So I think it's the psychological aspect, and people need to understand that the people who are imparting this information, it's not about just passing those things to them. It's about the whole family structure. As far as the rural health centers and in the basic health units, again, there's an issue. You see, when we think that we are going to build a building in the middle of a desert, and we think that we're going to send a young doctor who has studied in the urban community or, in the developed areas, he's suddenly just going to go there and his life is just going to completely stop for the next couple of years. He doesn't have anyone to mingle, anyone to mix up with. If he's married, he has children, he might need them to go to a school. So if there is no community support system within that, the basic health unit or a rural health center won't succeed. So when the government or the planners need to think that when they want to implement something, it is a holistic approach, it's an ecosystem. It's not just putting together, one infrastructure and sending one there. Having said that, that is a difficult approach and it's not easy. The short cut obviously is technological, and telemedicine is being used around the world. It is available. It is very, very approachable now. So here's a model which a lot of people have tried around other countries as well. Like, for example, in Australia, they're doing that where there's, large distances. So you have a community or a health worker, a similar health worker who could be providing knowledge and information to the other, population planning or other women, etc., could be the enabler sitting in that little rural health center or the basic health unit, and the doctors could be placed in the urban community in Karachi or in Peshawar or whatever, and they have access to all the tools. They can talk to them in a two-way communication. So this is doable. The thing is, the intent needs to be there. So once the government or the decision maker, whoever holds that, takes that into account, I think the population can be repurposed with technology, and a cost-effective solution, a workable solution can be brought in.
Fauji Foundation, their center is in Rawalpindi.
Right.
Within 70 kilometers of the radius, they send their movable medical team. They visit each and every village in rotation.
Yeah.
And they provide the doctor goes with them, and they treat the retired people because they don't have more resources. They treat the retired people, those who are entitled, right at the doorsteps.
Yes. Yes.
Similarly, their lady health visitors, they go and they provide the facilities at their doorsteps.
Yeah.
Similar method, if the doctors are not willing to go to the rural areas because of lesser facilities, so these type of things, for example, Fauji Foundation, as in Pindi, I know I have visited that place. They have in Jhelum, they have in Sindh, they have in Quetta, where are the big cities. They are providing the facilities to the retired people.
Right.
Similarly, if the government, if it's really interested, they can have in the bigger cities, they can have the center, and then within 50 or 70 kilometers of the range, they can go in the morning,
Exactly.
go to the rural area, they provide the.
This has been tested and tried. I know from my first-hand knowledge, a trust in the outskirts of Lahore, in particular UCs, but a trust out of private funding, developed an ambulatory system which focused on mother and child. And those UCs where they were sending these, so they had this huge movable ambulatory truck with all the facilities. It would go and park on each day in different UCs. And over a period of tens of years, now it's been, I think, more than 2 decades, they modified their consumption patterns, they modified their how they approach their health, they modified the outcomes in those UCs were completely modified. This was run by one of the public health doctor out of Lahore on a private sector. So these are the issue is governance, the issue is having the intent, the issue is having a common sense approach where you learn from your mistakes and you improvise. But if there is a disintegration, as Dr. Durrani was saying, if there is no interest, if there's no cohesion, then the outcomes are going to be all over the place. And then our focus is again on infrastructure. Let's build a new hospital, let's build a new clinic, let's build something else. And then when we are importing some products, then we'll be stuck. So today our issue is fuel. Tomorrow our issue is going to be we are importing solar panels. Now we have to pay for solar panels because it is being manufactured in China or some other country. So we are constantly jumping from one problem and jumping into another problem. We jumped from the availability of gas to import of LNG, and then from that we shifted into another problem. So we need to be looking into sustainable solutions versus quick fixes. So I think that we can do it, provided we really look at it from a holistic and a meta approach.
Humayun Shami from Pakistan Economic Forum. This is the basic problem that the doctors don't go to the basic health units, and a very big problem. 80%, my research is that 80% of the basic health units are without doctor. Either the doctor is not posted there, or if he is posted there, always on the run to get him transferred from there, or he doesn't go to the, so 80% are without the doctor. So my suggestion is that at the time of partition, my father told me that there was there used to be doctor. I don't call, maybe you know correctly, know the degree, that LSFM, something like that. It was used to be a diploma in the, so after matric they used to get 3 years and like a diploma medical degree. And those doctors usually were belonging from the rural area, and they have no hesitation to be posted there in the rural area. So you have a choice. Either you don't have a at all, you don't have a doctor, or at least you have a doctor who can at least give you the first aid, who can give you the, the basic thing. And because most of the basic health units are being run by the dispensers or even by the chokidars, they are working as a doctor.
Whatever I'm speaking for. So one of my companies, we did a project in rural Sindh, which we ran for 2 years. It was a funded project from US Embassy, and we had 15 centers. We created those centers a couple of years back, so about 2005 or 6, I think. So we created those centers, and the idea was, at that time, technology was not as cheap as it is today. And we created those centers. We took graduates, we trained them for 3 months, and we walked them through all subjects of healthcare, enough knowledge that they could become enablers. And they were the connectors with the, so it was a spoke and hub model. And obviously the spokes were in Karachi, and there were 15 centers in Tharparkar and Mirpur Khas and so forth and so on, supported with ambulatory care. And all the software was converting that into a local language. The printouts were coming in, and the prescriptions were coming in the local language. So these are the sorts of things that can be done. A lot of the developed countries have converted their shortage of healthcare doctors, because it's expensive to produce doctors, obviously. So what they've done is that they have gone for nurse practitioners. They have created carers in between. They can prescribe and they can do a certain level of interventions. Beyond that, they cannot go at the level of a doctor, but they're literally the shadow of a doctor, and they're taking care of a lot of the workload where they need to. So that's kind of like common sense, where you do not have enough resources, you create a more cost-effective approach. So these are the sorts of approaches, as you rightly said. We just need to maybe look at our history or learn from other, as I said, other success models within the country, in the private sector, or outside the country in other developing countries. So I think we can. But the minute we come out of our egos and our little institutions walls, I think we'll be able to solve the problems, and that's the way to mix together and work together.
You mentioned that, other countries in South Asia have managed to contain population growth rate with similar socioeconomic conditions. The only exceptions are Pakistan and Afghanistan. Here, the religious lobby is very strong, and it contradicts what the state wants to do in connection with population growth rate. So how important is this? How can we take steps to neutralize this? Because without that, do you really see a chance of us making progress? Because we haven't done anything in the last 40 years. And if this continues, I don't think we stand a reasonable chance of making progress. Your comments, please. No, this is my comment. I think I was speaking in Urdu, so it was difficult for you to understand. It was already explained that religious scholar and the media is the most important. These are the most important factors. And without them, it's impossible for the government of Pakistan to deal with this issue. So right now we have different forums. That is, one of them is a National Advisory Forum of all religious leaders, and they are with us from different sects, and they're working on that. Similarly is the case. So I think, sir, just a quick here, sir, the side of that, as per Nelson Mandela statement, countries where education, and I'm also a doctor, please. So where education and health become profitable businesses, उस मुल्क को कोई भी तबाही से नहीं बचा सकता. And you just see education and health is flourishing in Pakistan, number one. Number two, ये है कि, sir, I think health and population, it's a very important issue, and we must have a separate session. Let these people to decide, to guide us how to deal this issue. मैं तो बुरी हो गई हूँ, मैं तो नहीं कर सकी, मेरे ख्याल में जो मुझसे पहले वाले भी थे. Now let them to advise us to what to do, because we need to resolve this issue. तो सर, मेरी एक इसमें humble submission है कि आप एक अलग से वो करा दें और हम उनके साथ इनके साथ बैठकर एक अलग से करें. Thank you so much.
Also said, आप basically awareness mass level पे करते रहें, funding mass level पे करते रहें, it won't matter, because it's not one of the problem, it is the main problem. जब तक आप उस फैक्टर को एलिमिनेट नहीं करते या उसको पनिश नहीं करते कि वो किसी भी जगह पे खड़े होकर कोई भी स्टेटमेंट दे सकता है. So just a comment on this.
Thank you very much. As I said, that all of these issues are so important that we can speak for the entire day, but I can already see our next panel speakers as well as the panel lead sitting in the audience and waiting very patiently for us. Few of the things that I would just very quickly say, that the worst thing Pakistan is doing to itself is lack of education and awareness on basic issues. The question about the LSMF partial doctors was that we have so many of these quacks and people sitting besides us, even in the major cities, that the very fact certain councils or our regulatory authorities have forbidden them from carrying practices is primarily that they are playing with health. And getting a degree, a fake degree, is actually no longer a problem, which is again adding to the overall corruption that is prevailing our society. And if we play with health the way we are playing with so many other things, and as we play with health, that is extremely drastic. So the little measures, preemptive measures that we are undertaking may go in whatever direction, how we want to interpret it. But I think there is no shortcut to education, no shortcut to awareness that comes with it. And empowering women, having a gendered approach to our overall security policy is very important, because several things that we are looking at, health, education, that our mothers decided for us, cannot be done at semi or semi-rural or rural level, because the woman there is not empowered. She may have a very high IQ, she may have a lot of initiative, but she's bogged down by the cultural norms, by religion, by a husband who thinks he's a god or a demigod, or however the structure works. Perhaps you also I come across many young girls who come from rural background, who are brought to the universities by their fathers because they want their daughters to get educated. My colleague in the audience, Dr. Ijaz, would vouch for that. So it's not that the man is not the enabler. He is the enabler, but it's also the overall socio-cultural norms that restrict them. So disproportionate resource distribution, the way we have approached the polio problem, the way we kill the health workers, the protectors around them, speaks volumes of how we look at anything that is foreign, that is attacking our religion. The sooner people realize that contraceptives are coming from India, it would be Modi's conspiracy against Pakistan and having less conformist Muslims performing their duties. So let's not inform people at large that these contraceptives are not Pakistani created. But the last word is that we need to research and bring up with our data and our statistics. The more we research into these things, and honest research, not copycat research, the more it would be better. But these are not shortcuts. These are long-term issues that need to be worked out. I'm extremely grateful to the audience for patiently sitting through the session, to my three extremely eminent and knowledgeable speakers. I benefited a lot from your presentation. I'm extremely grateful to IRIS, to Ambassador Nadeem Riaz for giving me this opportunity to chair this session and learn a lot in the process. And this is about it. I think Zunaira is waiting to make logistical announcements. And I also feel there's some very good thing waiting for you all.
Thank you so much, Dr. Salman. Thank you to all our